Hey guys, welcome back to Honesty's channel. So today is October 1st. Happy October. And we are officially in the countdown to baby Henry being born. Just in 20 days and counting. So he's going to be born on the 21st, which is our scheduled C-section. Ironically, that was our daughter's due date, though she was born with an emergency C-section on the 20th. So her birthday is October 20th, and her little brother Henry's birthday is going to be October 21st. And I am officially 36 weeks pregnant, and we are almost halfway through the week of number 36. So this is how the baby bump is progressing, and everyone's like thinking I'm going to go into labor earlier than the scheduled C-section date for cesarean surgery. Today, walking around, just like getting groceries and running some errands, I did feel like I was ready to have this baby, but we have so much to do and only like 20 days to do it, so a little over a couple weeks to get everything done and taken care of. So I'm pretty stressed and overwhelmed. And I know I shouldn't be stressing the baby and everything, but I can't help it. I'm getting the jitters of like trying to accomplish all of this stuff before he's born. My husband still needs to call HR, Human Resources, to put in for his paternity leave. And he said he'll do it tomorrow morning before work, and just everything else. I mean, we're so close to having this baby. I could have him be born today or tomorrow. But, I mean, we're hoping he stays in the oven, so we have at least 20 days to get everything in order. Now, so today is Tuesday? On Friday, I'm going to get the last few things I need for my hospital bag. I need to pick up some little bottles of like shampoo and conditioner and some pads. But other than that, I have all of the clothes picked out and washed that I want, the blankies and pillows and everything else I'm bringing to the hospital prepared. I might want to pick up like a deck of cards or something to play cards with my husband while we're in the recovery room, because we'll be at the hospital for like 2 to 4 days, depending upon. So this week we are celebrating 36 weeks being pregnant in the third last trimester. Our son, our baby, now is about the size of a head of romaine lettuce, like a pretty big head of lettuce. And that's around 18 and 3/4 inches and 5 3/4 pounds. So we are officially in our last 9th month, the 9th month of our pregnancy. It has been a pretty long pregnancy. So during 36 weeks, you may feel like breathing can become a bit easier as the baby descends towards the birth canal. Well, I hope so. Like, I haven't really felt the weight on my throat this week, but I mean, it's still hard to breathe with all of the heartburn. I only had like one good night of sleep this week, and all the other nights are normal, where I wake up every hour, like needing milk or with my throat burning or having to pee, puking, just normal, not getting any good sleep. Except that one night, that was good because I caught up on, I haven't had much sleep this past month at all, so, or during this entire pregnancy. And what else to do? During 36 weeks, childproof the nursery, setting up baby gear, just try to nest, and learn how to tell if you're having early contractions like Braxton Hicks or early contractions or false contractions, false labor like Braxton Hicks. So know the difference. If you're like having real contractions, I guess it's like you feel contractions every 5 minutes for like consistently for an hour. But I mean, it's kind of hard to tell the difference between Braxton Hicks and real contractions. And with our daughter, my water didn't break. So I don't know if my water's going to break with Henry. They'd probably have to puncture it themselves if it doesn't. So I don't know. There's different cues or like hints that you need to go to the hospital. So just study up on those if you think you're going to go into labor early. Baby development at 36 weeks. The weight gain accelerates as the baby's still packing on pounds, and at this rate, about an ounce a day. He's making meconium. The baby's shedding most of his downy covering hair, the lango, as well as the waxy substance of the vernix caseosa that protects his skin during the long amniotic bath. Now he's swallowing both of these substances along with other secretions, resulting in like a blackish mixture, which is the meconium, that will form the contents of his first bowel movements. So he's making his first bowel movements. And also during 36 weeks, if baby is breech, well, most likely your baby's already in the right position, head down, like hanging like a bat. But if not, your caregiver may schedule an external Suffolk version in which like they're going to try to turn the baby and apply the pressure to the abdomen to see if they can like manipulate the babies into the head down position, like turn. I did that with my daughter when she went breech and it didn't work, and it was really, really, really painful. And yeah, I mean, now that we know I'm already elected for another cesarean, it's not necessary for me to do that. But if you want to try to get a practitioner to move your baby, just know that it may possibly really hurt for you. I don't handle pain very well, but they apply a lot of pressure to try to turn the baby. There's other ways to get the baby not to be breech, like hanging upside down on the couch and just different methods you can look up, house, old wives' tales. So our son Henry did go breech last week, but then this week when I went in for my stress test and monitoring the heartbeat and the movements, we did the sonogram after, or the ultrasound, and my doctor's like, yeah, he's not breech anymore. He just keeps like floating around in there and like doing somersaults, like always switching positions. But now that I'm doing my second section, it doesn't really matter if the baby's breech or not. They just don't want to deliver a vaginal birth with a breech baby because they prefer to be pulling head first rather than like foot first. It's easier for that type of delivery. So pregnancy symptoms at 36 weeks, decreased appetite. I mean, yeah, I haven't had much of an appetite like since the middle of the second trimester. Definitely this third trimester, I haven't had much of an appetite at all. This week, not so much either. But like when I do eat every day. And I try to remind myself, like, even if I'm not hungry, I have to feed the baby. But I end up, being sick and puking it up anyway. And I just try to digest as much food as possible because during the afternoon, because I know, like, at the nighttime, I'm going to be really sick. Or in the, like, really early morning. Oh, I try. Breathing can become easier lower abdominal pressure, abdominal pressure. I do feel a lot of pressure, and like sometimes I get cramps in my sides. Usually it's the right side, but today I noticed I was getting a cramp in my left side, and just so much walking around and bending down and picking up things, even if it's just like a toy on the ground, cleaning up around the house, is just a lot, and it gives me tummy cramps. And just knowing the signs of labor, so you can speak with your doctor or a midwife um, to know the signs of labor and what your body is preparing for. So I feel like perhaps I might make a video about just knowing the signs of labor in itself, because that's going to go pretty in depth. So each month has an average of 30 days, except for the last month of pregnancy, which has 1,372 days. That's funny. That was just a little pregnancy joke from Baby Center. And then the pregnancy checklist for 36 weeks is make food for after the baby's born, so you don't have to prep and everything. And then especially like with having a cesarean, my husband's going to be doing all the cooking, cleaning, driving. So like we have some prepared meals. It might make it easier on him. I'm sorry, I'm really tired. And then pack the hospital bag for the hospital or the birth center, which I am almost complete doing that. And when I have it all set up, I'm going to be done by the end of this week, putting my bag together. Then I'm going to make the videos of my husband's bag, my bag, what to pack, the ultimate checklist to pack for you, your partner, and your child. Bring the diaper bag and what you should bring for baby, what is necessary, what's not really necessary, but if you feel like you want to bring some diapers and wipes, you can bring those along too. If you have like preferences, though they will offer that stuff at the hospital as well. And just, think about like your birth plan. If you're going to have an epidural, um, or a spinal tap, or if you want to ask for any medicine at all, or if you just like want to gung-ho go completely natural, not have any medication, but then like halfway through decide, yeah, I do want that epidural. So just keep your options open and know what you want. For sure, I am going to have a spinal tap, which is